I'm gonna clap.
The normal response for this test is the ability to keep your eyes open when you know the clap is coming. This is my patient Amanda. Amanda has some long-term chronic stress and some injuries in the past. They have accumulated and woven themselves into her nervous system and what we call negative neuronal plasticity. Now she's hypersensitive to the environment. That includes sound and touch. Watch her facial expression when I stroke her right foot versus when I stroke her left foot.
Push up. Try this one again. So it's interesting. Feel your face. Do you feel the difference?
Yeah.
Which side's worse?
My right side.
Yeah, 100%.
This video is for both the general public to demonstrate what chiropractic can and can't do with the more advanced concepts that are entering the profession. It's also for practitioners to show how we can test patients and evaluate their nervous system. This is our second session.
How are you after last visit?
Good. I slept really well, which was nice. It was pretty helpful. Then I've been noticing that just like my back and my neck and stuff are just really bothering me, and I'm having a lot of pain and stuff in my hips and my legs right now.
So your sleep was good.
Yes.
How was your, in general, mood?
I felt calm. That's kind of like the best way to describe it.
Yeah.
I just felt a little bit more like peaceful. I didn't feel like so chaotic.
How's your sensitivity to touch?
Okay right now, but there were a couple days since the last time I saw you where it was a little bit more sensitive.
Okay, let's check out your balance.
Okay.
Every office does it differently. In my office, I use balance and muscle testing as a part of our normal exam to evaluate what the patient's doing, how their system's operating, what level of anxiety they're under, and what their balance looks like. So balance is actually an indication and a window into brain function.
Feel the toe.
Okay.
Head up. Eyes closed. All right, we still got work to do, don't we, man? I'm gonna clap. One time, you ready?
Okay.
Okay. We still got a lot of work to do. Push up for me, go. Good. Try again, push up. Good.
For us muscle testing practitioners or practitioners who incorporate primitive reflexes, observing the patient's face is a great window into how their nervous system is interpreting information. And it's a great insight into how they feel and how their body is processing this kind of signaling.
Push up. Try this one again. So it's interesting. Do you feel the difference?
Yeah, I don't.
Feel your body. Feel your face. Do you feel the difference?
Yeah.
Which side's worse?
My right side.
Yeah, 100%. Bend this knee for me. Don't let me pull.
Here I'm measuring the hip flexors,
Don't let me pull.
and those are both normal. However, when Amanda turns her head to the left, this right hip flexor becomes inhibited, and that is abnormal.
Don't let me pull.
It's normal on the left.
Okay.
I had a suspicion because of her stress. She's probably been grinding a lot, affecting her TMJ. I want to see what gapping the TMJ has upon her reflexes. This is something we practitioners, specifically those practitioners who do not do muscle testing, can use to evaluate TMJ dysfunction. I didn't expect that, but you're all good. You relax. One of the things I'll notice with my patients when they're nervous is they'll squeeze their hands or they'll curl their feet or cross their feet. It reminds me of when I'm at the dentist office having pain inflicted in me. So I will gently remind the patient to calm down, to relax their grip, to calm their body, soften their stance, and that I'm paying attention to their details and not doing anything abruptly that will startle or frighten them.
You're good. You're in good hands, okay? If you two feel uncomfortable, let me know. I can kill the camera as I can stop.
Okay.
You're all in charge, okay?
Mm-hmm. That feels really good.
Most of our patients who've been under long-term stress are going to have fatigued these muscles through grinding. So we're getting the temporalis, the masseters, the medial and lateral pterygoid muscles. This will help reset the sensitivity in these muscles. Remember, muscles send signals into the cerebellum, then send signals into the cerebrum. So when we have muscles that are overstrained or injured or not working, we're going to have a decrease of appropriate proprioception and stimulation into the brain, which will cause negative secondary consequences.
We're not done. I want to stroke that foot again.
Okay.
How's that?
It's better.
Yeah, we're going to adjust your jaw.
Oh, yeah.
Now, are you the shy type at all or no?
No.
Do you mind if I bring some other docs in?
Sure.
Doc, do you want to come hang out with us? Tina, you want to come hang out with us? So everybody be comfortable with one another. I know our space is limited. Tina, I guess for you specifically, because it's your first time here with us, be comfortable and relax. Everybody, we are videotaping, so feel free to chat and chime in. And this is our patient, Amanda.
Hi, Amanda.
Hi. Hello. Hi.
She has been suffering from
A lot.
general anxiety for a long time, panic attacks, and she has a sleeping problem. Her touch is uncomfortable. So when she gets touched, her skin fires off. She has a generalized stress response, so I'm not going to do it again, but when I clap, one of the tests we can do as practitioners is we look at our patient and we should be able to clap and tell the patient the clap is coming, and the patient should be able to keep their eyes open. She can't do that. When I stroke her foot here, her face makes this.
This response had corrected itself when I performed the external trigger point work on the temporalis and the masseter muscles and the muscle under the jaw. However, it was temporary. The thing about massage, which is a phenomenal healing technique, it's more peripheral. We're going to use massage in combination with chiropractic, which is a more central technique to help with the proprioceptive inputs into the brain. Let's segue for a moment and recognize that muscles fire into the cerebellum, and the cerebellum fires into cortex. The cortex then fires back down to control muscles. Simultaneously, muscles control joints, and then joints send signals into the right cerebellum and then fire up into the cortex. This is important to remember that we practitioners are affecting brain function. We're using the body to get access to the brain to make corrections. In this case study, we have a patient whose brain is interpreting signals abnormally, and in the process, she's having this awkward responsive sensation. If we can correct joint dysfunction and muscle dysfunction, we should be able to correct the brain's interpretation of these signals.
Calm that way down.
That's
Gently
usually
close your eyes.
TMJ.
In her case, any patient that's had long-term chronic stress, we want to go look at TMJ. They've been grinding for 20, 30 years or 10 years or 5 years, whatever. They don't recognize it. Maybe their partner does it at night in bed. They can hear the grinding. We saw the video of the TMJ, right? So that video tells us that a patient's having external stress now becomes incorporated internally. Now you have a joint that doesn't work or it's jammed up, and then it causes a lack of inhibition. I know, forgive me. You like me when you get off the table? Does that matter? Ready? Still there. Okay. We're actually going to adjust this joint. Tina, are you comfortable? Are you okay? All right. If you need to sit or anything, let me know.
Hi.
So I'm going to have you just gently open your jaw. There it went. So she got really sweaty.
There.
Still there.
A little bit.
So remember, these are our really extreme hypersensitive patients. Most patients will not have this. 90% of our patients, 95, are not going to be this sensitive. But you've been under a long-term chronic stressor.
Yeah, I have chronic Lyme disease, so for 15, 16 years now. I told him I'm just going to keep coming back because this feels good. Oh.
Don't worry, Tina, I won't put you on display, okay?
No.
All right. If I can help somebody else, I would be.
Amanda's next visit will be interesting. We will recheck this reflex and see if it's stayed corrected or if there are other areas of dysfunction still contributing to this sensation.
Push up. Good. So that Babitsu's response. Think of the average chiropractor that's not treating feet or TMJ. Now you have these joints that don't work properly, they don't move properly. Then a person steps 10,000 times a day, so they step 5,000 times on a foot that's out. Now you get these abnormal signals into the brain, and then you get these responses all day long, right? That's always low-grade problems there. So I'm going to tap the bottom of your foot. Push up for me. Okay. You're not. This is a move that some patients
I like it.
don't like. So one of the things I'll do with patients is I'll feel their palms after adjustments
You're sweaty.
profusely.
And that means?
Joint's been out of place for a long time.
Okay, so it's a good thing.
It's a good thing. Yeah.
It's a little hot.
Yeah. So
You want to take your sweatshirt off?
I'm all, it's
So
okay.
what happens is blood vessels open up, and then all this blood comes through, and blood carries heat. So patients get this real sweat response when they've been out of place for a long time and you adjust them. All right, from the top, push up. Go. Push up. Push up. I think we're doing the same adjustment on this foot too. We have to be cautious because when you're this sensitive, so joints on one side of the body, stimulate the same side cerebellum. So right side, right cerebellum, left side, left cerebellum. She might need certain adjustments that we might have to postpone doing because it might stimulate her brain in the wrong direction. So don't worry, you're in good care.
I know. I'm like,
What one are you going after with that one?
Fifth metatarsal.
just all kinds of hot and sweaty. It's fine.
How's that feel?
Better. It doesn't feel as like the only word I can use to describe is like cringy on my right side. If
Yeah.
that makes sense.
Yeah. Okay. Push up for me. Great. Again, push up. Wonderful. Push up. Wonderful.
I feel like I have to strain more to push up on my right side.
Go.
Feels like it takes more effort to keep it like feels like I'm steadier on my left side than my right side.
You are. Yeah.
Okay.
Push out for me. We're going to do some more exercises in a second.
Okay.
Head right for me. These are our tonic neck reflexes. Push out. Should be strong, and it's not here. Try again. Go. So we're going to go look at her neck. So the issue, this is a good example. Her left jaw corrected things, but the left jaw fires into the left cerebellum. But she's a right cerebellum patient where she's having issues on her right side. So being cautious with her once again. Am I killing you?
It's fine.
It's not fine.
Mom.
Head right again for me. Push out. No. Okay. You rest. Head straight. Did you get sweaty from that too?
Mm-hmm.
Amanda, I'm going to put pressure on the back of your tongue for 5 seconds. 5, 4, 3, 2, 1.
You should get flavored.
That's a great point.
like bubble gum or something like that.
Yeah.
Remember like kid dentists, they used to like pick a flavor.
Does this hurt the same?
I was hoping that treatment, putting pressure on the back of the tongue to help stimulate her 10th cranial nerve, would have inhibited this pain response. It did not. However, it did correct her tonic neck reflexes.
Push out. What corrected that reflex? Push out. Head the other direction. Go. Ready, go. That one's good. Push out for me.
Same.
Yeah,
side?
keep your head low. Go. Try this one again. It's okay, that's fine. We're not done. Did you get sweaty from that last exercise? Yeah.
Thank you.
Yeah.
I'm all just sweaty.
So, long-term chronic stress, but any type of head trauma. Head trauma deactivates a nuclei, the vagal nerve, vagal nucleus in the midbrain. And gagging a person is one of the ways to stimulate it. That deals with heart rate, heart, lungs, and digestion. 10th cranial nerve is one of the parasympathetic nerves, right? 3, 7, and 10. So that mechanism to get it to work in patients with head trauma, that's the treatment. One of the treatments. Why don't you go walk for me and just see how your body feels? You don't have to have any major changes.
Okay.
You good?
Mm-hmm.
All right, go walk for a little bit. See?
I think so. Does my hair look great?
Beautiful.
Dizzy?
It's like a pain right up in here. It's fine.
Okay. Are you dizzy at all or no?
No, it's like a pressure right here.
I'm going to give you a lift and then we're going to go have you lay down for a little bit, okay?
Okay.
Drop your arms.
It feels really good.
All right, now go walk and just see how you feel.
Okay. Okay,
How's
we're
that feel?
better?
How's your forehead pain? Still there?
Yeah, it's just like pressure, but
Let's go do this. Let's go to get you to lay down for a little bit and
Okay.
then we're going to do a little more treatment in a moment, okay?
okay.
Come.
Bye, everyone.